Hey, how's it going?
Pretty good
Right on in.
yourself?
Yeah, doing pretty well.
Are you ready for your 52 questions?
Absolutely.
All right, let's start with an easy one. What is your name?
I'm Sam Malkinson.
And what is your specialty?
I'm a periodontist.
How many years have you been practicing as a periodontist?
10 years now.
Oh, congrats on your 10 years milestone.
Thank you.
Which school did you go to?
Well, when you ask for school, you're talking about
I meant
dental school?
Sorry.
So I graduated from McGill University.
Okay, and where did you do your residencies?
So right after McGill, I did an AEGD, which stands for Advanced Education in General Dentistry, at the University of Connecticut. And then the year after, I did a GPR, which stands for General Practice Residency, and I did that at the University of British Columbia. And then right after that, I did 3 years of my perio specialty down at Virginia Commonwealth University.
Wow, that's a lot of years of school. What did you like about McGill's dental school?
The thing that I would say I liked the best was probably the family atmosphere that existed back then.
Okay, and what did you dislike about it?
Well, back then, we didn't get as much experience with extractions as I wish we had, because as soon as I got into residency, I had a whole bunch of extractions to do, and I didn't quite feel prepared.
So what is the most challenging aspect about the dental profession, according to you?
The most challenging aspect for me, I would say the most challenging aspect of the dental profession for me is walking that very fine line between my ethical responsibilities to my patients and, as a specialist, also my ethical responsibilities to my referring dentists.
Yeah, that can be definitely very tricky. How did you handle stress as a dental student, whether it's during dental school or residency?
I was very lucky. I'm still very lucky. I had really good family support, and also my then girlfriend and current wife Jess, really awesome support, and a fair bit of exercise. I usually, when I get frustrated or I need a sort of a meditative experience, I usually hit the gym and do a workout, and that kind of helps.
That's awesome. Did you always want to become a dentist?
Ever since I was 16 years old.
Did you have any doubt going to dentistry?
I probably had doubts as to whether I would actually get in, but once I decided that I really wanted to be a dentist, I certainly had no doubts that that was the right thing for
me. So what specialty did you think you were going to go into when you entered dental school?
At the time that I was applying, I thought for sure I was going to be an orthodontist.
Like a lot of us. So what made you change your mind about that specialty?
I would say it was about second year dental school. I realized in second year that actually ortho really wasn't for me.
Okay. And throughout dental school, were there any specialties that you were like, oh no, this is definitely not for me?
Pediatric dentistry.
And what made you go into periodontics?
When I was at my AEGD in Connecticut, I noticed that I was gravitating toward a lot of perio procedures and perio patients, so much so that my colleagues in the AEGD, rather than referring perio cases to the perio specialty down the hall, would send those cases to me. I started getting fairly good at it that year, and I had one of my clinical instructors take me aside one day and say, "Sam, you obviously love this stuff. You're an idiot if you don't go and pursue this as a specialty." And I remember that night having the chat with my wife, or my girlfriend at the time, my now wife, Jess, and saying, oh my goodness, this means another 3 years of school. How do you feel about that? And Jess was like, oh, well, this is what it's going to be. This is what it's going to be. If this is what you really want, we have to pursue that. And so the rest is history.
For sure. And was there any turning point in your education or a moment that you knew this was the specialty for you?
Once again, it was really that moment at the AGD when my clinical instructor took me aside and said, "You need to pursue this."
Okay. And what did you do to prepare before applying to residency?
The thing that we did, and this was for residency, not for specialty, but the thing that we did the summer of third year dental school is a buddy of mine and I went on a road trip to New England, and we hit up 6 different residency programs, and we met the residents and we talked to the residency directors and all that sort of thing. And it was actually from that trip that I identified Connecticut as the place that I was going to be going.
A well spent road trip then. What did you wish you knew before going to residency?
I wish I had known that it's very important for you to like the residency program and for the residency program to like you in the same way, because it's not a given that you will fit into that particular residency program, and it can be quite an unpleasant year if you don't love it and if they don't love you.
Yeah, for sure. So finding the right fit is definitely important. And did you start residency right after dental school?
Yep. I think I had a month of downtime, and then July 1st, 2007, we were into it.
Wow. What was the hardest part about residency for you?
The hardest part about residency. When you ask the question, I think you mean specialty. I think the hardest part about specialty.
Yeah.
So I would say the hardest part about specialty were the exams that we did. My faculty in Virginia at the specialty program was all ex-military, and the program director there, also ex-military, very much believed in training us to such a level that when we got out and into private practice, there would be nothing that we saw that we wouldn't be able to handle. That everything would be, relatively straightforward. And I thank him every day in my prayers because that's really aided my clinical practice.
So that does sound tough. Now, on a more brighter note, what was your favorite part about the specialty school?
I very much liked the team that we had there. We were working with a group of very motivated people who all wanted to try very hard, and we were healthily competitive with each other. And that was a really nice environment to grow.
So next question, for the people out there, why should someone choose their specialty?
Go into periodontics if you really like being the director of treatment. A lot of people will contact a periodontist and say, I don't really know in what direction to take this case. Where do you think we should go? And so I find myself very often directing overall treatment plans. So if that appeals to you, that's the kind. Periodontics is a great place to go. It can be a very surgical specialty if you want it to be. So if you do like surgery, I definitely recommend it. And also I would say there are a lot of opportunities for research and teaching within periodontics. So if the idea of doing some research or doing some teaching appeals to you, then periodontics is a great specialty to go into.
So now comes the devil's advocate. Why should someone not choose their specialty?
Basically, it's the opposite of everything that I just said. So for example, if you would prefer not to be directing treatment, if you would rather act as a technician where someone just says, do this, and you just do it and you don't think too much about it, then periodontics might not be for you. Also, if you don't love surgery, if surgical intervention is not your thing, while you can be a periodontist, you might not enjoy it as much because many of our treatments are surgical in nature. And finally, if teaching and research does not appeal to you at all, the specialty might not be quite so enjoyable.
And what does an average day look like for you?
So I would say in an average 8-hour workday, and it's average because these things change day to day, but I'd say I probably spend 2.5 hours doing some form of consultation or follow-up, and probably 5.5 hours doing some form of surgical intervention.
What do you look forward to the most when you come into work?
I really, really enjoy seeing the results of my clinical procedures, especially when those results are nice.
For sure. Who doesn't like a good patient-dentist alliance? What do you look forward to the most when you're leaving work?
Hanging out with Jess and our two daughters.
Oh, that's so sweet.
Yeah.
What is your favorite thing to do when you're not working?
Probably running. I do a fair bit of running.
And what is the least favorite part about your job?
The least favorite part about my job would have to be those conversations with patients where I have to explain to them why something has gone wrong when that something was done by another clinician that wasn't me.
Yeah, I can imagine that can be a very hard question to answer.
Very uncomfortable.
Yeah. How many patients do you see a day typically?
So that varies. It will depend what I'm doing that day. If it's a day that's very heavy in terms of consultation and follow-up, I could be seeing as many as 20 patients a day. And if it's a day where there are some very large surgeries, it could be as few as 4 patients a day. And in fact, I can even think of one particular day where I only saw one patient because the surgical intervention I did on him was so extensive that I didn't schedule anybody else that day, so I could focus exclusively on him.
So what's the most amount of patients that you've seen in one day?
Well, I would have to guess, because I've never actually looked at my schedule to figure that out. But if I had to guess, I would say probably my top is around 25. But that would be including some impromptu consults that I'll sometimes get asked to do, because there are other dentists who work on our floor here in this building, and every now and then I get called in just to be like, hey, come have a look at this.
Wow, 25, that's quite a bit.
That's quite a bit.
And how many hours do you work a day, or a week, sorry?
Yep, so it's 8 hours a day, 40 hours, so 5 days a week, 40 hours a week, 48 weeks a year, no evenings and no weekends.
No evenings, no weekend. And what's your favorite procedure to do?
The lateral window sinus lift.
What's the most difficult case that you've had to face?
I can remember a case which came in a few years ago of a gentleman that had 2 implants which were failing. These 2 implants were anterior implants in the aesthetic zone, and these implants had to be taken out, and the patient had to be grafted with both bone and soft tissue, and the plan was to put in new implants. Unfortunately, this patient was poor at healing, and the procedures that I had planned didn't go well. In fact, I had to redo several procedures, until at one point I realized that this case was beyond my skill to manage, and I ended up referring him to another specialist.
So now if we switch around, what is the most impactful patient story that you have?
The most impactful patient story that I can think of right now is a relatively recent story, and it's a young mom who came to see me, I would say it's about a year and a half ago now. And when I asked her what her chief complaint was, she said, my son won't let me kiss him. And I said, oh, tell me a little bit more about that. And she said, my son complains that I have horrible breath and he won't let me go anywhere near him to kiss him. And I don't know what to do. I'm kind of, I'm very upset about this. I said, okay, let's talk about all the different things that might be causing this bad breath. And when we went through an exhaustive medical history and everything else, it turned out that the only thing that was going on that I could see needed to be fixed was the fact that this lady was not flossing and had never really flossed. And I asked her if she knew how to floss. And she said, I mean, is it really that hard? And I said, well, let's take a few minutes and let me show you how. And we spent 15 minutes, and I showed her how to floss on a model, and then I let her floss her own teeth in front of a mirror, and I said, now listen, I want you to do what I just taught you once a day for the next 4 weeks, and then you're going to come back and you're going to tell me how things went. And she said, okay, but don't you have some special medication or some special mouth rinse, or maybe there's something wrong with me? I mean, isn't there something more complicated or in-depth than just I wasn't flossing? And I said, well, ma'am, I really think you should try this out, and we're going to reevaluate in 4 weeks. And 4 weeks later, she came back with a big smile on her face, and she said, I don't know what you did. It must be magic. But my bad breath is gone, and my son lets me kiss him again. All I was doing was flossing. And I said, well, that's wonderful. I'm so happy that we were able to manage that situation in the simplest fashion possible.
For sure. We do love a nice, happy ending. What time do you usually leave the clinic?
5 p.m. There are definitely days that I have to stay late, but those days are rare because of the way I set practice up.
Okay. And how long does it usually take you to chart?
Not very long at all. If you're efficient about it, and if you're smart about it, and you have some templates prepared for your files, then actually charting is really quite quick.
That's actually a very good tip to save on so much charting time.
Yeah.
What time do you usually wake up?
Between 5 and 6 a.m. Depends if I'm doing an exercise session in the morning.
So how many hours do you usually sleep?
If I'm being perfectly honest, 6 hours a night.
6 hours. And how do you handle work-life balance now as a professional?
So once again, I'm very lucky. I have really good family support. The biggest thanks goes to my wife, Jess, who's the best support you could ever ask for. And of course, my 2 daughters are always there, happy to greet me at home. So this is wonderful. But I should also mention, because they're a big part of it also, that my parents and my brother, all of whom live here in Montreal, are also really good at being a part of family life and helping me out when I need things. And that contributes a lot to that work-life balance.
For sure, for sure. I'm sure they're as lucky to have you as well. And how much time do you have for family and personal hobbies?
Never enough. That also has to do with the stage of life that I'm at right now. I'm a dad to two children, 6 and under. So that comes with all kinds of things that just take up our time. So any time that's not spent at the office, obviously the first priority is family stuff. And when family things are all taken care of, every now and then I can get away for a hobby or two. Most of that time is devoted to exercise, but I have a few small hobbies here and there, I suppose. But as the kids get older and become more independent, I suppose I'm looking forward to enjoying a bit more hobby time.
For sure, that's fair. That's fair. And what is the quality that you find the most important to have as a dentist?
Integrity. And in this context, I'm going to define integrity with a quotation from the British author and poet C.S. Lewis, who once wrote that integrity is doing the right thing even when no one's watching.
Well, that's powerful. Would you ever want to own your own practice?
No.
Have you ever worked in a rural setting or a small town, and how did you like it compared to the big city?
I have always worked in either a rural setting or a small town, and I continue to. And I love doing that. It's not my main office. It's somewhere, in this case, that I go once every 2 weeks. But I think it's very important. It's very healthy. It helps me grow as a professional also. I manage to service and manage a population of patients that's very different than what you would normally see in the center of Montreal. And I think that's a very important thing to do. And I just fundamentally enjoy it. Every now and then it's nice to break up the monotony of the week with something completely different.
Yeah, that's amazing. And what is the most common dental advice that you give to your patients?
Floss daily.
Yes, do not forget about flossing. What is something that a mentor or another specialist that has told you and stuck with you throughout the years?
So when you ask that question, there are 2 bits of advice that come to mind right away. And the first bit of advice, I'll drop the name since she's one of your professors. The first bit of advice came from Dr. Véronique Benamou, who's currently, at the time of this conversation, is the director of the division of Periodontics at McGill. And Dr. Benamou told me when I first came back, she said, "Sam, it's going to take you 5 years to get established as a specialist here in Montreal." And it turned out she was very precise about that. That was completely accurate. I started becoming a lot more comfortable with my place in the general specialty landscape in Montreal after almost exactly 5 years. And the second bit of advice came from the first periodontist I ever worked for. And he took me out for lunch one day and he said, "Sam, you are going to spend the first 5 years of your practice doing all of the things that you're going to spend the rest of your practice avoiding." And at the time when he said that, I was like, that's a funny thing to say. But once again, it turns out that after 5 years, there seems to be a theme of this 5 year itch, as it were. After 5 years, I noticed that some of those things that I would do, which maybe weren't working out the way that I wanted them to, I stopped doing those things and I started changing to things that were had a higher percentage chance of success, let's say.
Yeah, it does seem the magic number is 5. If you didn't do dentistry, what other career path would you have liked?
Professional diplomat.
If you could change something about dental healthcare right now, what would it be?
I think it's reasonable to say, without getting too political, that we could be doing better for the sections of the population that don't always have the finances to have access to, or even the geographical location to have access to high level dental care.
That's definitely important. And what do you think are the gaps within your specialty or dentistry in general?
Something that I've noticed the longer I've practiced is we are losing the ability to work as a team toward helping out a patient. We tend, and maybe the pandemic has exacerbated this problem, we tend to work in our own little bubble, but actually patient care is best delivered when you have the dentist and whatever specialists are involved, all working together as a team toward the same goal.
And what changes do you foresee in the field of dentistry in the next few years to come?
Honest truth, I don't think there will be that many changes. There might be some evolutions in the sense that technology might get faster and maybe less expensive in certain regards, and therefore more available to certain people. But in terms of actual changes, there haven't been major changes, in my opinion, in a long time. Sometimes people dress up evolution as major change, but actually I don't always agree with that perspective. Often it's not really a change at all. It's just been sort of dressed up as something different.
That's an interesting thought. What is a goal of yours what's your goal in the next 10 years?
To get my motorcycle license.
Ooh, motorcycle. And we're almost done. So what advice would you give to pre-dental students out there?
If you're pre-dental, if you're not yet in dental school and you're thinking of applying, my advice is to find a dentist or a specialist and ask if you can shadow them at the office. I think one of the things that I never did, which I should have done, was just to spend as much time as possible in the environment of a dental office, because that's the way you'll find out if that culture, if that lifestyle, if that career is right for you.
And now, what advice would you give to aspiring dental students right now who are trying to apply into periodontics?
Exactly the same advice, and I would take it further and say it goes for any specialty or whatever they want to do after dental school. I recommend shadowing in private offices as much as possible. That's how you learn whether those life choices and that direction are right for you.
Those are wonderful tips. Thank you. And that's basically it for the 52 questions. Now I have a bonus round of rapid fire questions. Are you ready?
Hit me.
So dogs or cat?
Definitely dogs.
Pineapple on pizza, yes or no?
Sure, absolutely.
City life or country life?
3/4 city life, 1/4 country life.
If you could have dinner with anyone in history, who would it be?
They say you shouldn't meet your heroes because you might be disappointed, but I don't agree. And someone I always wanted to have dinner with, and will never get the chance because he passed away coming up on a year ago now, is a man named Richard Marcinko, who was the founder and first commanding officer of SEAL Team 6. And I've got all his books and I've read everything. And if you can get past the extreme profanity in his books, he has some very wonderful messages to give, just in terms of life, in terms of learning, in terms of teaching. In fact, I quote him in my dentistry lectures every now and then. And like I said, he passed away in December of 2021, and the United States lost a true military hero. And I think everybody lost someone who was not afraid to speak his mind and call a spade when that needed to be done. So if I had to pick someone, I'd say it would be him.
That's a very good person to have. Which country do you want to visit?
Argentina.
Argentina. Favorite color?
Red.
Favorite dish to eat?
Oh boy. I will answer this two ways. If I had to pick a dish it was the only thing I could eat for the rest of my life, I would have to have this one dish at every single meal for the rest of my life, it would be sushi. But if it was my last meal and I had to pick my last meal, it would be a nice big ribeye steak.
Name one thing that is on your bucket list.
One thing that's on my bucket list. I'd like to run a half marathon.
What is your go-to song to lighten your mood?
To lighten my mood, anything by Coldplay.
And last question, and I think this is the most important question. Are you happy?
Yeah, very much.
So that's basically it for all my questions. Thank you so much, Dr. Malkinson, for taking the time to answer all these questions.
Thank you for the opportunity.